Okay, how about a short story about what is insulin? Insulin is a hormone that's produced by your body. All humans with a pancreas, that's the organ that produces insulin, specifically in the pancreas, the islets of Langerhans cells. There's some trivia for you. Those cells produce insulin. Now, patients with type 1 diabetes do not produce insulin. Their pancreas is not producing insulin. Now, compared to type 2 patients with type 2 diabetes, those patients produce insulin, however, small amounts, or that insulin is not used very well by their body. But we're talking about patients with type 1 diabetes. Our pancreas does not produce insulin. Insulin is a hormone, and as I talked about before, it is necessary to transport glucose, which is sugar in the blood, into cells of our bodies. All organs, all tissues, all body parts require glucose, sugar in the blood, for energy, for rebuilding those cells, those body parts, for function. Blood glucose, sugar in the blood, is required for everything to live. Now, insulin is this carrier that takes the glucose out of the bloodstream and puts it into those cells. So, patients who do not produce insulin, type 1 diabetics, patients with type 1 diabetes, require insulin to be given because our body's not producing it. Insulin has to be given so that we can transport that glucose into the cells. So this insulin that is, you could think of it as a medication, however, it's a man-made hormone, has to be given to the body. Now, insulin has to be injected. It's a liquid in a small vial, and I'll show a picture of, I'll show it here in just a bit, but it has to be injected into the skin by a shot, by a needle, by a syringe. There is no tablet form or pill of insulin. And the reason being is because insulin has protein. Its chemical makeup has protein in it. When or if it was given by mouth in a pill form, the small intestine would start to digest that and it would be out of the system before it even took effect, before it did anything. It needs to be in the blood system to be carried to the cells and transport the blood sugar, the glucose, into the cells. But it will not get there in pill form because our stomach, intestine, small intestine will start to digest and break that protein down. So it's not effective given by pill form. That's why it has to be given by a shot, by injection. So you have to use a needle, have to use a syringe. It comes in a bottle, in a vial, small vial, and you have to get the amount that you need and then inject it. And it's injected not in a vein, not like a drug, or you might think that you put it in a large vein. It would, again, be distributed throughout the body too quickly in a vein. It's kind of like putting it in the fast lane on the freeway. It's going to go quicker and not be used as well. So it has to go into what they call subcutaneous tissue, subcutaneous skin. So it's just under the skin level, just underneath the skin, not necessarily into a muscle or into any particular part of the body, but just under the skin. And I'll show an injection. I'll give myself an injection here a little bit later. But that's how it's administered, how it's given to the body. Now, type 1 diabetic is not producing insulin 24 hours a day. We never make insulin in our body. So these injections have to be given multiple times throughout the day. And there are different types of insulins that act or work at different time frames throughout the day. And I'll go through those here in a minute. If the type 1 diabetic patient is not giving themselves injections, most of the time, type 1 diabetes patients are using an insulin pump, which I have, and I'll go through details on that later. But there are little cartridges that we fill with insulin, and pretty much that little cartridge has enough insulin in it to last a good most of the time, 3 to 4 days worth. And it's giving us pumping through the insulin pump, giving insulin 24 hours a day. Small amounts, almost equal to that of a normal person who's producing insulin. Along with using that insulin pump, we also, what I call punch the buttons. We add extra amounts of insulin when we need to correct for high blood sugars, or most importantly, and most of the time, when we eat a meal. So again, I mentioned counting carbohydrates before, counting carbs in the foods we eat. Depending on how many carbohydrates we take in, there's so much insulin we need to give for that meal as well. Now, back to insulin. There are 4 different categories of insulin. There's a rapid acting category, and the generic name on that is insulin Lispro or Lispro. The brand names are Humalog and Novolog. This type of insulin is usually used, this is what's usually used by patients with type 1 diabetes in their insulin pump, which I use. And the reason being is because once that insulin gets into your bloodstream, or it takes up to 15 minutes for that insulin to get into the bloodstream. So it acts fairly quick. Actually, rapid acting is what they call it. And it works at its highest strength, its peak, anywhere between 30 to 90 minutes after it's injected or after the amount is given. But it's out of the system in almost, an hour, sometimes 2 hours. So it's in and out quick, about as equal to what a normal person's insulin use would be. Now, there's also a short-acting insulin. It's called regular insulin. Usually the trade names are Humulin R or Novolin. When you inject that, it starts to work in about 30 minutes or even an hour after it's injected. So it takes a little bit longer to get into the bloodstream to actually work. Its peak or its strongest point is usually around 2 to 3 hours, and it's out of the system, out of the bloodstream in about 3 to 6 hours. The third category is called intermediate acting, or the letters NPH, and its trade names are Humulin N, Novolin N. After it's injected, it takes about 2 to 3 hours before it starts working, so it takes a little bit longer. Its peak action is anywhere between 5 to 8 hours, 5 to 10 hours. So it's not going to give the effect of transporting that blood sugar till roughly 5 hours or so after it's injected. And it's out of the system, out of the bloodstream in about 10 hours. So it's a lot slower acting insulin. And finally, there's what's called a long-acting insulin called Lantus. And after it's injected, still takes about 2 to 4 hours before it starts to work. It does not peak. So once it's injected, it works steadily for up to 14, 18, 24 hours. So it takes a long time. It doesn't necessarily peak and do a lot of work at a certain period of time. Once it's injected, it's a long, slow burning fuel, you could say, insulin, that is. Now, back to insulin, just the basics. Uh, if this is something the body makes, how do you get a little vial, a little jar of this to inject? Where does that come from? Well, it's made by a DNA gene that's harvested and is grown with bacteria and yeast. There are 3 companies in the U.S. that make that. I believe Eli Lilly Company, Novartis. I might have said that wrong, and there's one other, and I'm off the top of my head can't think of the other company. The one that I use, I believe, you're going to catch me on some trivia here, I believe is made by Eli Lilly. But again, this is made from a DNA gene that's been harvested and mixed with a bacteria and the yeast to make it grow or to manufacture this insulin. And it's primarily given by prescription from doctors writing this order for insulin. Again, it's to be injected subcutaneously, and there are different speeds or time frames that these different insulins work. So hopefully that's some good information for you. I'll add on a little video on actually administering some insulin, both by needle and through a pump. But there you go. That's what insulin is, and that's how we use it.
Okay, so here's a demonstration of an insulin injection, and I'm going to be using what I use in my insulin pump, Humalog. It's the rapid acting insulin that starts acting within 15 minutes of giving this, injecting this in my body. It has a peak action time of roughly 1 hour, 30 to 60 minutes, and it's out of my system very quickly in 60 to 90 minutes, maybe just a bit longer than that. Now I am going to show giving this subcutaneously, meaning under my skin, and like I say, I use this through an insulin pump, and I'll show you how that's used in the pump as well. So here's what a person with type 1 diabetes has to do. We take alcohol prep pad, washing hands first, all that. But alcohol prep pad, wipe it across the top of that insulin vial. Then we'll take the syringe, and I'm only going to give myself 2 units, so very small, but you can see this syringe has graduation marks all the way up to 100. Obviously, we're not going to take that much. That would be a pretty heavy spike of insulin. So, taking the cap off the plunger, taking the cap off the needle, what we'll do is draw out enough air, so that's 30 units, if I can get that into focus. There's 30 units. Like I say, we're not going to use that much, but I've drawn that much air through the needle for 30 units. I'm going to pump that back and forth just to lubricate the inside of that syringe for the 2 units I'm going to do. So I go back down to below 10, so roughly 2 units there, and I'm going to inject that air into the vial that I've already cleaned off. So it's in the vial. I'm going to push down on the plunger, and as you can see, that might even be 5 units there, half of that 10. I'm going to inject that air into the vial. Okay, so I've got an easy 5 unit amount of air to push as I turn this upside down and draw out those 5 units of insulin. And you can see there's a little bubble at the end of that. What I'm going to do, I'm going to take the syringe out of that vial. I'm going to turn this pointing up, and I'm going to click. I say click, should use the word flick, to try to get that air to come out. That's why you see on TV or in movies a nurse flicking a syringe, and it's to try to get that little bubble right there out. Well, other than flicking that, you can actually push. You can push that bubble near the surface to where it's about to come out. Otherwise, I just have some air. Now, I'm not injecting this into a vein. Let's see if I can get a little bit more of that out. And sometimes it won't. You just simply, air in under the skin is not going to do any damage. Air into a vein will. So I've got roughly 2 units. Now, I'm going to turn the camera here, and I'm going to use a alcohol swab. I've already opened the package. I'll use an alcohol swab and show how to inject this under the skin. Okay, so I rolled up my shirt. I've already done my draw in the syringe of insulin, the 2 units. I'm going to use the alcohol swab over the area that I'm going to give the injection. And again, I'm going to do this at the stomach. It's usually easiest for us diabetic patients to give the insulin at the stomach. Easy to reach. Sometimes to the hips, sometimes to the thigh. But what I'll do, that area that I just swabbed, I'm going to pinch just a little bit of skin. I'll put the syringe right into the skin. Doesn't hurt at all because it's very thin gauge, meaning small gauge. And you can see I've got that all the way in to my stomach there, to that skin. And then I'll just push the plunger in. There's 2 units. Comes out. There's no bleeding or anything, but that 2 units is now working, or at least under my skin. It'll start working within 15 minutes, that rapid acting insulin. But there it was. That was a quick injection. Now, in comparison, this is insulin being given through an insulin pump. This is the pump. You can see it's about the size of the palm of my hand. It's about the size of what, if any of you remember what a pager was, or a small flip phone. And you can see about the thickness of it. Now, inside of this insulin pump, I'll take this, spin this cartridge out, there is what's called a cannula. And it's, for the most part, it's just a collection, or it's a canister. I shouldn't say canister, but it's a little plastic container that's got roughly 3 days worth of insulin in there. And this insulin pump is giving the insulin 24 hours a day at a set amount that's already been programmed in. So I'm constantly getting insulin. However, if I am to give extra insulin for a meal or to correct a high blood sugar, this device will push that plunger in there and squeeze out or push out more insulin depending on how much I need. Now, it's very small amounts. Again, this holds 3 days worth, and that is spun into that pump just like so. Now, to give myself insulin, I actually have to punch and program an extra amount. This insulin goes from the pump through tubing, and that tubing goes all the way to an area where I'm going to expose the part where it goes all the way to an area. Let's see if I can do this with one hand. I'm not a cinematographer, so I'm not the best at this. But it goes into some tubing, into this little, almost a Band-Aid type patch that's on my skin. And it's got a very fine, small, very fine little plastic tubing at the end in here that goes underneath my skin. This thing is worn 24 hours a day. When I program that insulin in, it goes through that tubing into this little spot that's got a plastic tubing under my skin. And again, this is on me 24 hours a day. You can tell there's some reddened area here. That's a side effect of using a pump. I'll talk about that in another video, but over time, that skin gets irritated. It actually gets fatty deposits around there, scarring material underneath, and it affects how easy that insulin goes in. But once I add that extra insulin in there from my pump, that's where it goes. Okay, so that's the comparison of needle versus insulin pump.